Hi there, good afternoon. Welcome to this webinar, Back to Basics for Surgical Instruments. It's my pleasure to have Bob Marrs join me once again. Very kind of Bob, and Bob's going to be giving us his expert input on various subjects through the presentation. So we're going to start the slides off in a minute or so. We're just waiting for a few other people to come online. So if you bear with us a couple of moments, please. Okay, great. Well, I think we'll get started now. Format will follow as we've done previously for these events. Is we'll go through the slides. So Bob will give input on a few of the subject matters along the way, and then we'll hopefully have some questions at the end. So please feel free to raise questions around anything instrument related we haven't mentioned, and hopefully between the two of us we will be able to answer. So I'm just going to go and share my screen now, and also lose my face to save you having to look at me for the presentation.
Let me lose mine as well.
Okay, there we go. Great. So yeah, surgical instrument, back to basics. Surgical instruments obviously have been around since ancient Egypt and Roman times, obviously going through modernization over the years due to availability of new materials, and obviously stainless steel in the last 100 years or so being available. But of course now we're seeing even more changes and more complexity with these instruments, with the introduction of robotic surgery, of course, as you can see in the photo here. But we're going to try and focus on the basics and take it from there. So we believe, well, I believe personally, that surgical instruments in hospitals nowadays is a collective responsibility. There's so many different stakeholders involved. Of course, the patient whom the instruments are being used on, but of course, sterile services who are reprocessing the instruments, theatre staff and clinicians who are obviously using them, as well as other factors such as procurement. So it's a very, very involved subject matter. And this is a slide that I often like to use to start off with, which is in fact a piece of iron ore. So I think this for me is really fundamental to understanding about surgical instruments and the basics of surgical instruments from the perspective of the compositions of the stainless steel. So iron extracted from iron ore makes up around 80% of the composition of stainless steel. There are other elements involved as well, such as carbon, which allows the steel to be hardened and to be fit for purpose, and nickel and chromium each play their part in relation to corrosion resistance. Chromium allowing the device to be oxidized, passivated, which we'll come to later, and giving it its shiny finish. So I think what we've got to remember is that iron oxide is iron in its most stable state, and you'll be familiar with the orangey taint on the iron oxide, which obviously is very, very close to the color of rust. And that's a very, very important thing to remember, that when we're talking surgical instruments, okay, so we're extracting the iron ore through smelting, extracting the iron from the iron ore through smelting and obviously processes such as that. But when it comes down to it, we've got to remember that an instrument that's nice and shiny, nice, bright and shiny, like the one on the screen, there's a lot more to it beyond just being a stainless steel surgical instrument. So there's a lot more in the composition that we need to understand if we're going to have a real grasp on how instruments can last potentially for sort of 20, 30 years. So I think to understand about modern day surgical instrument manufacturing, it's good to know where iron ore is mined nowadays. So over in Asia, obviously you can see from this graphic here that it's no real coincidence that as iron is mined from these areas, that a lot of obviously the stainless steel is produced in these areas, and no coincidence that obviously instruments are quite a lot of manufactured in these areas too, which is of course fine. For me, the really important thing is no matter where instruments are manufactured or where steel or forging is manufactured, that the standards that the stainless steels are produced to are really, really stringent in relation to international standards. So here is a few different standards that really in the UK, ISO 7153 is an international standard for the composition of stainless steels, which is obviously a worldwide standard. Medical device directive at the moment for class 1 instruments, and there are also British standards such as the 5194 range, which really gives specifics on quality and things like geometry of box joints, testing materials. There are of course other international standards such as the German DIN standards, which perhaps are slightly more modern, being that the British standards I don't think have been updated since '95. So here is an extract from ISO 7153, which gives a breakdown of 420 stainless steel. So this is the compositions, the different compositions of the stainless steels, and the yellow, the three yellow highlighted rows at the top, and actually D as well really should be included, are probably a sort of common parameters that instruments are made from. The important thing to look at here, and I'm not sure if you can actually see my pointer, is the C really, and that gives the carbon. So if you look down the list, really you'll see as the carbon goes up, the suitability for the device to be fit for purpose for harder operations where the device is required to be harder will follow. So for instance, the sort of D, you're looking at things like chisels and osteotomes that need to be really hard, therefore they've got a higher composition of carbon. And on the lower side of things, a B, something like an artery forceps, which needs to be a bit more flexible, or a dissecting forceps. And on the other side of it, you'll also see a CR, which is chromium, which tends to go up as the level of chromium goes up as well. To explain this a bit more, on the screen here we have an osteotome, which obviously needs to be very, very hard if it's going to last. Therefore, again, just reflecting back on where the steels and instruments might come from, it doesn't really matter too much where they come from, providing these correct parameters and compositions are followed. And yeah, so if you look here, we've got between 0.42 to 0.5 carbon, and the Rockwell hardness, which is obviously very, very important as a manufacturer. You would test that to make sure it's correct, to ensure it's going to last and do the right job.
Dan, I think this is a great place to remind everybody that it's really, really important that they understand where their instruments are coming from and who they're purchasing from. Understanding that quality process, because it's very easy to fall into the we want to pay less, so we're just going to order instruments from X and bring them in, and then they begin having issues. So really important points there.
No, thanks, Bob. That's, I mean, very, very true. And what we quite often see is if we look on a tray and you look at the perceived to be cheaper instruments, or the instruments that aren't as important, things like sponge holders, hemostats, and you know, quite often there's not the quality investment isn't made there, and therefore the instruments don't last. It also brings up other issues such as potentially cross pollution when if the instruments you know, corrode. So on the screen here, passivation, for instance, if you've got passivation will only work if you have the correct composition of the stainless steel, because it relies on the chromium in the instrument. If that chromium's not there, it can't have a reaction with oxygen, which allows it to form that chromium oxide layer, which is the passivation layer, indeed an invisible layer that that can be very susceptible to damage. So it can be easily scratched, and things such as laser marking done on the instrument, if it's not treated or passivated after, potentially could go rusty. There are modernizing machinery for laser marking all the time. That area is improving all the time. There are processes that don't actually really need too much passivation after laser marking nowadays, and in situ treatments that can be done to reduce that. But as a rule of thumb, if the surface of the steel is damaged, then obviously you have the potential for the iron to leach out. And if we reflect back to our image of the piece of iron ore, to understand that. But Bob, obviously there's a lot of things that can affect this layer as well. I mean, in your experience, things like chemistries and water, of course, can cause issues too.
Absolutely. I'm currently working with a customer that's having some pretty significant issues with both water and steam, and seeing the impact on the instrumentation has been really eye-opening for the customer. Being able to explain a lot of these very things about the passive layer being damaged, using stiff metal brushes to scrub and scrub and scrub on the instruments to try to remove a stain. While they'll remove the stain, often they're damaging that passive layer, which then opens the instrument for more corrosion. So yeah, for sure, it's very, very important to understand this piece. It's interesting. Manufacturers used to recommend that when you receive new instruments, that you run them through your washer disinfector a few times prior to using them to help kind of bolster that passive layer. And then a lot of them don't even talk about it anymore. But I tell folks when they get them to go ahead and do that, even though we know that instruments are having that passivation layer applied during the manufacturing process. It's also good to kind of break them into your own system and run them through the system a few times.
Yeah, no, I agree. I mean, there's nothing like testing the instruments with your particular setup. And I mean, obviously, if you're doing passivation, you validate the passivation in-house as a manufacturer, but you don't. I think without those sort of test runs, and it's just, I mean, it's not a particularly technical scenario, but really just performing your own sort of initial validation with the devices you receive, I think is always a sensible suggestion for sure. So yeah, just to stick up a slide there, we all know what rust looks like. For a familiar sight on my garden gate at home, which is nice and rusty on the hinges. And obviously, if we don't, this is where stainless steel, the surface has been damaged over time. Therefore, the iron is allowed to leach out from that, and you get this sort of picture. I mean, obviously, this would be extreme with instruments, but it can happen. And this, I think, as I just mentioned to Bob there, you've got a real challenge in the UK, or you have such a variety of different sources of water, rivers, streams, groundwater, varying, hugely across the country, and that can lead to massive changes and variation in mineral as well that are in the water. And I appreciate generally we're using RO steam, but there are other elements during the process and the instrument reprocessing where perhaps there might not be RO water, and you've only got to look at the difference in chlorides between London and Cambridge here. Obviously high alkalinity as well, but the chlorides are the things that are going to do the damage to the surface of the instrument, and they're going to cause things like pitting. You'll only really get pitting where you've got chloride issues, so that's sort of worth remembering. And of course, different, as I mentioned, tap submersions, steam generators. Bob, you'd get some variation throughout the department in terms of where the water comes from. Am I right to say?
Very much so. It's one of the primary issues here in the United States. This water and steam, folks really need to understand how important it is to the life of their instruments. I remind facilities, often we think about capital purchases here. We think about the big items like a Da Vinci or an anesthesia machine or a big fracture table or something in the operating room. But an average 10-room operating theater here in the United States can have a stainless steel inventory between $2.5 and $3.5 million. So often they don't think about that much of the budget being tied up into our stainless steel, but golly, this having water and steam that is of poor quality it's just going to destroy your instruments, and you're going to wind up replacing and refurbishing instruments continually. So it's very, very important that folks have their water tested at their manual sinks, make sure that they've got good water feeding, their ultrasonics, their washer disinfectors, and like you said, RO, even feeding the steam system so they can take care of the instruments inside the sterilizer as well.
No, that's really interesting. I mean, we've seen recently as well on the decontamination side of things, inconsistencies with where surgeries are using saline that might be cardiovascular surgeries that require the use of saline and can't use sterile water, and that adding to the mix as well, and can be a real challenge to then pinpoint where the potential issues are occurring. So certainly keeps you on your toes.
Absolutely.
So yeah, so I mean, moving on to this slide, as building all of the competition stuff in, obviously quality is more than just looking pretty when it comes to instruments and looking shiny. We know that. We think in terms of a definition of quality, I think in surgery we've seen sometimes surgeons that have particular devices that they think look brilliant because they've got amazing coatings on them that look really nice and shiny, but you know, when it comes down to it, quality is a bit more than that. And personally, I believe that, you know, a good reflection on quality nowadays, particularly in the UK, is a balance between quality and selling price. And we have to make sure that when we're looking at stills, we're looking at due diligence as well. So I think it's worth being aware that, you know, we've got these standards we've mentioned, and you can test the instruments to those standards to make sure that they've got the correct amount of the composition. And that's something that as a manufacturer that we do as part of our due diligence for instruments, and indeed when we're manufacturing implants. Surface finish is often something that gets overlooked, and when we hear quite a lot about validations of sterilizers and washer disinfectors, I'm always amazed that this isn't something that's focused on more, because as this research shows, there's a big variation between corrosion resistance on stainless steel depending on how the surface finish is finished. So a rougher surface finish performs not as well as a finer surface, which may seem to be fairly obvious, but I think obviously these are microscopic pictures, and it's sometimes not that easy to tell. If you've got a really, really rough finish, you can easily sandblast over it to make it appear to be a nice fine finish. So that's something certainly to remember as well, particularly if you've got variations of finishes of instruments across trays. And yeah, it's all to do with the wettability of the device, really being that obviously if you've got a rough surface and you've got water droplets on the surface, the water will not run off as quickly as it will on a smooth surface. So something to think about there. The picture of some of our instruments just to show you can achieve a really definitive finish change between the different areas of the instrument. If you're manually polishing it and you have the skill to do so and finish it correctly, then you can finish to a really, really bright polish, and then you can apply that finish and you can still apply a different texture to the instrument whilst maintaining a smooth surface finish. So it's something to be aware of, that not all surface finishes will behave the same. And Bob, I've seen research around post surgery gels, enzymatics and things that perform differently when they have got these different surfaces. I just wondered if you've got any, you know, something that you might have seen.
Yeah, absolutely. Not only the chemistries, but the water and steam again. And I see a lot more. It seems like the kind of the matte or the not shiny finish is the one that shows more staining, more corrosion than the shiny polished finish. So it's something that I definitely see here a lot.
Yeah, it's difficult because I think in Europe, like a lot of the German instruments generally will be a sort of you know, like a matte finish, you'll see which can be obviously a really high standard, really fine. And then other areas in the world you might get a sateen finish, which isn't as potentially as good. And in the UK we're used to a bright polish finish from sort of the down surgical devices and things like that. So again, it's it's a lot. There are a lot of different things to take on board, but that's certainly something to think about if you're experiencing different results in your wash, is to look at the different surface finishes. Also, if we're learning about the basics of instruments, we've got to appreciate that some instruments are single use, and that's what the symbol when you see it. And interestingly, I've got one round one way and one round the other way on the slide, but obviously 2 with a line through it means not to be used again. And in the UK, generally speaking, that is the case, that it won't be used again. And we're seeing more, more space for single-use devices. I think where it might practically make sense. So things like suction tubes that maybe are difficult to clean, or very delicate devices that again, if you don't clean them while you're protecting them, they can become damaged very easily. So single-use obviously has a good use in that respect. But yeah, certainly not reprocessing. We'd hope to think you wouldn't see any instruments on your trays that would have this symbol on them. Interesting to just pull up here that the image on the left is actually an original Spencer Wells, which was invented in the late 1800s. So a lot of the instruments, particularly the ones that we sell, are established designs that have only really changed slightly. If you look at a modern Spencer Wells to the right, obviously we've got the change in the box joint from what was like a lay-on screw joint and an internal rack to obviously a slightly different rack or ratchet, as somewhat people might call it. Interestingly, the one on the left probably nowadays would be easier to clean because you can actually take it apart. So and indeed the rack is protected from damage because it's internal to the device. So some things modernized, but maybe not always for the better. But of course we know that box joints are used on a very high percentage of instruments nowadays. And here are the different sort of common features we might see on instruments. I've already mentioned box joints in the top left there, seen on Spencer Wells, mosquitoes, Crowels, screw joints, obviously very common on scissors. Bit of a difference sometimes on screw joints, you'll see a sort of real screw, as we would call it, which sounds very untechnical, but what it means is you can actually take it apart and sharpen the device rather than something which may be sort of riveted over. Then you've got ratchets that are common on retractors, sort of self-retained retractors, Norfolk and Norwich Wests and such like, and teeth that are obviously on tissue forceps. And I've got a couple of slightly more detailed images a bit further on. Racks, as we've just mentioned from the previous slide, they're found on needle holders, artery forceps, and of course scissor blades, funnily enough, on scissors. Lumen is a term that you'll probably hear quite a lot, and that's probably, as I mentioned, more akin now to single-use suction tubes. Differences in serrations and teeth. Obviously bows would be found on scissors, and yeah, really nomenclature of instruments, understanding how an instrument name is broken down. And if you're new to the industry, generally you'll get the surgeon's name, where the device is used, and then the type of instrument. So for instance, Spencer Wells artery forceps being the surgeon, and then obviously the type, obviously the type of the place that the instrument's used, and then the forceps. So that is really fairly common. I think that's something that, although we've got some differences in names in the instruments in the States and UK, I think that's pretty consistent, Bob.
Yeah, very much so. Same thing, and I often remind folks that the challenges that the CSSD technicians face when they're assembling these trays, there's 4,000 different patterns here. Some manufacturers have over 5,000 patterns, and so these technicians are expected to know how they work, they are expected to know the name of them, how to clean them properly. So it's really a challenging a task, and truly the best way for them to be able to identify the instruments is by the marking on the instrument with the number rather than applying additional tape. Sometimes you'll see tape, sometimes you'll see where instruments have been color coded with a dipping process. And here in the US right now, that's a big no-no. A lot of the surveying bodies are hitting hospitals very hard for tape that's been applied to an instrument because it causes corrosion, and often it's not maintained. But yes, lots and lots and lots of instruments.
Yeah, I mean, that tape, as you mentioned, I know, you know, may serve a purpose in terms of IDing an instrument, but yeah, I mean, we handle a lot of repairs, and some of the debris that we see under the tape when it's removed just doesn't really bear thinking about. So yeah, you want to try and, I think, time spent on education and trying to learn some of the devices, which, you know, you will pick up if you're handling trailers every day. There are probably 30% of the tray that are going to be on every single tray, bar some of the specialities, but that you do then get familiar with those names. So just moving on to some of them, which you may see feature wise, you have, when you're dealing with artery forceps and clamps, you'll open up the device, and some will have a serrated jaw, which on the left, like a traditional sort of serrated jaw, which can be quite coarse. And other devices will have what is known as an atraumatic jaw. So that's essentially the same thing, but with a reduced surface area to reduce the pressure in the area, normally a delicate area that the instrument is clamped on. So it is very important to realize this, because obviously if an instrument is being used in obviously on a very delicate artery, we wouldn't want the wrong clamp being used that is too coarse and could cause damage to that. So not only identifying that, but also checking for damage, because the atraumatic teeth are very fine, Bob, aren't they, across different instruments. They appear on, you know, DeBakey dissecting forceps and a variety of different clamps, DeBakey clamps as well.
Absolutely. And I'll kind of go back to your thought on the inspection of the instruments. It's really, really important that these teeth are looked at very closely, particularly on artery clamps, where maybe through the process, if they've attained a burr or something like that, and we miss it, potentially that's something that could damage an artery, as opposed to being an atraumatic clamp, it becomes a traumatic clamp. So really, that inspection piece is very, very important, in understanding the different teeth and how they should look.
Yeah, that's it. And checking for burrs, as you say, vital. There is tests you can do that other sort of manufacturers may mention, where you get a sort of a polythene bag and put water in it and try and clamp it to test. But yeah, I mean, really, you want to have a look under the microscope and check those teeth and make sure there's no inconsistencies there. And you'll get other sort of ends on the instruments as well, meshing teeth on things like Alice tissue forceps, other styles of serrated jaw, as I'm showing in the DeVal, and as I mentioned on the DeBakey dissecting, the atraumatic, which is a very common instrument that will appear on a lot of trays. And there are some instruments you look at and you think, well, you know, what is the difference? And sometimes the instruments help you out and have some defining feature to allow you to distinguish them. And in the UK, you have the Gillies and McIndoes. McIndoes generally known from a longitudinal serration that you'll see across the device, and Gillies has a serration, a grip. Gillies has the grip going the other way. Gillies will generally be a 1 into 2 teeth on the end, and McIndoe normally serrated, although we've seen 1 into 2 varieties pop up as well, just to really confuse everyone. And retractors, yeah, there's lots of different retractors. Norfolk and Norwich type retractor, sort of self-retaining with your ratchet that you see there. That's what we would call an internal rack, which is a sort of modern rack that is applied to instruments. And then you've got your handheld retractors, such as your Langenbecks, Cocker Langenbecks, and then bigger retractors, which generally might be used for opening up sort of chest cavities in cardiovascular, and there are a lot more complicated types of devices such as on those, which really depends on the procedure they're being in, but being used on things like IMAs, Denver wells, really fairly complicated blade systems. Again, something to point out on those is where they are used in cardiovascular, quite often they'll be used with saline for longer periods of surgery. So really important to check those devices after they've been used, because obviously they're going to be in use longer. The blood obviously that's on them can cause damage. And of course there's other more complicated retractor systems as well. Bookwater here, which we have the pleasure to distribute in the UK, and I understand is quite popular in the States as well. There are other, of course, retractor systems quite similar, but this retractor will generally be in one or two baskets due to its weight. There's a table post which attaches onto the ring, and then the retractor blades can be attached to the outer ring by way of different ratchets, which are excellent, because I think, as you know, if you're in surgery, then you don't actually have to hold on to them, and I believe that's how Dr. Bookwater actually invented this device, by falling asleep whilst holding a retractor, and then realizing that actually wasn't needed at all. So yeah, so there's a bit of a story there. So onto needle holders, and some of the defining features of needle holders. Well, the jaw is really the main thing that distinguishes a needle holder, and generally speaking, that's tungsten carbide, and that will be why these have a gold bow or gold bows on them. That is to give you that indication that the gold bows mean that there's a tungsten carbide insert on the device. Other comments such as, you know, what laser etching might be there, to give a bit of insight into the different layouts of instruments. Obviously what a ratchet is, we've discussed that already. Mayo Hagar and Crowell have been very popular needle holders. Obviously the Mayo needle holder being a very robust needle holder, and Crowell finer, that you might see on some of the finer sets, all the way down to some of the plastic sets.
Yeah, Dan, one thing I always try to share with everybody is to remind them how important it is to inspect the needle drivers. These needle holders, needle drivers are often one of the last instruments used in the surgery, and often are not clean. So they come down coated with bioburden, which can become a biofilm. But because of the different metals in the tip where the jaws are, having stainless steel, and then the tungsten carbide, and then the solder, which holds the tungsten carbide piece onto the needle driver, it's very susceptible to corrosion because of those three different metals reacting with one another as well.
Yeah, I mean, that is really important. Actually, I've got an image, a couple of slides on, to sort of illustrate what Bob's saying there. But, and again, it's quite, because of the combination of different materials, it's quite hard to spot. So that's something that, you know, we'd recommend magnification for. Just to say, gold handles would mean tungsten carbide insert. And again, on scissors, tungsten carbide will appear. It's not the same as on a needle holder. It tends to be brazed into the jaw, but if you have a look on any of your scissors that you've got on your trays that have got gold handles, sort of hold them up to a light or under magnification, you'll probably see a sort of steady line down the jaw of the scissor, which will be an indication of tungsten carbide. And they're popular because obviously they last a lot longer because of the hard insert. So this is what a close-up of a tungsten carbide jaw on a needle holder would look like. Obviously, as we say, zooming in and checking the formation of the jaw, making sure there's no breakages. But the other thing which is useful to understand is that the reason you have different needle holders is they'll quite often have different jaws. So this graphic here just shows that a much finer needle holder or needle driver jaw is designed for holding, obviously, for finer procedures that are used in more delicate procedures, such as the micro jaws, the fine jaws there, which debake is obviously very common on cardiovascular trays. And then slightly coarser jaws will be used on needle holders such as the Mayo Hagar, as we've mentioned, Cryle Woods. And as manufacturers, when you're manufacturing needle holders, obviously you have to make sure it's got the right jaw that's suitable for the job as well. That's very, very important. Further to the identification, black bows, again, that's for identification purposes. That means supercut. Is that the term that's in the States as well, supercut, Bob?
Yes.
Yeah, okay, great. On a strabismus scissor, again, popular scissors there. Really, the most common scissors, I guess, we see the bottom two are Metzenbaum and Mayo scissors. Metzenbaum being a dissecting scissor that is again very fine and used on multiple trays. Stevens tenotomy scissor up the top there can be used in plastics or again finer surgery work, but all have these black bows. Some of course may be available also in with tungsten carbide bows, but the black bow is indicated there's a supercut edge which looks like that. So you have one edge that's like sharpened to almost like a sort of cutthroat razor edge, and on the other side a serration which is very, very fine, and you may need a magnifier to see that, but it's really, really important because that's what those combination of those two edges is what gives it the supercut. The grip given by the serration, and then obviously the slice or cut is performed by the finer edge. So that's, I think, something we see quite often when things go out for repair, if they're not repaired correctly, that these edges are damaged. And of course, you may see a scissor that looks like this, which has gold and black, which is a combination of the two, supercut with tungsten carbide. Just a graphic, just summarising them all there, and there's some. I'll make this presentation available at the end if anybody needs to see this information again. We might also see some coloured coatings nowadays, and I think, Bob, you mentioned earlier that different colour coatings or different types of coatings have occurred, and these, you know, there's a blue and a sort of orangey colour here. Generally speaking, there'll probably potentially be some sort of titanium nitride coating, but not all will be suitable or robust enough for the washing process. Quite often we've seen attempts at fancy sort of colourings on instruments, and they generally, after they've gone through the tough, you know, fairly harsh cycles, they don't last too well. Hey, Bob, are you seeing any widespread use of sort of colour coding or anything nowadays?
Pretty much, we're just finding the gold and the black coating on instruments, and any others would be a kind of a third-party coating where they're dipping it in almost like a ceramic type coating, color coating. And again, most people are moving away from that because we're finding that they crack, and kind of you have the same issues that you'll see with tape quite often. Yeah,
okay, and I understand. And obviously anything that is seen to be deteriorating, then obviously people are going to start to worry that potentially you could get residual bioburden or protein, I suppose, in those areas. I mean, most commonly we see the gold bow there, which that would just be like a gold plating, so like a gold plated sort of jewelry. But you can get more robust gold coatings that, as Bob mentioned, like there's a gold and black titanium nitride, which are very, very strong and generally won't come off. But anything that's a little bit more elaborate and has a color on it, I would always ask for information on it to make sure that you know, that obviously it's not going to come off when it goes through the wash or sterilization process. And that's what some nice gold titanium nitride instruments look like. This was actually a project we did for identification of those devices to ensure that they separated out a pool of instruments actually for CJD in the UK. They were for post 97, so that was a coating applied over the top, but that's what that may be if you see that on your trays. Just to mention here quickly, Rick Schultz in the States has his coaching cards, and some of the slides I'm going through are fairly similar to Rick's cards, and I think it's a product I would advise you to check out if you haven't already. Really, really good for learning the devices and learning you know, some of the common features when you go through them. And as we move on to maintenance, I'll share with you a few more of those cards. Bob, just before we move on to the maintenance side of things, have you got anything else that you'd like to input at this stage?
No, I think we have good topics going, and look forward to hearing the rest.
Great. So magnifying glass, as we mentioned, and repairs, which I think some sort of magnification, if you're going to take the time and you have the, you should make the time to actually inspect the instruments properly. If anything, like an sort of eyeglass type thing can work well to put them on the instruments. But Bob, you were saying you see out in field now investment in microscopes and more intense kit for inspecting instruments. Yes,
I run into that occasionally. So it's always recommended that we have lighted magnification at the workstation. So having that ability to look more closely at the instruments. So we'll see lighted magnification, but also some folks are moving even to microscopes and then borescopes to look in lumens to ensure that they have in fact been cleaned and taken care of. And I just have to say, this is, a lot of times we can get tied up in the saying, if a device is not clean, it can't be sterile, which is true. So we put this huge focus on cleaning and sterilization, but quite often this inspection piece is overlooked. I would say the majority of the time it's overlooked. Even when I'm on site, and I think I just recently hit just over my 200th hospital that I've been in, watching the process. I will see folks that have the tools to inspect, but they don't use them. Often it's because they're just trying to get things back to the OR theater because they don't have enough instruments or whatever it may be. But that inspection piece will totally negate the cleaning and sterilization if these instruments go to the operating theater, and the surgeon is frustrated because his scissors don't cut or her clamps don't clamp or whatever the issue might be. But this part is so vitally important.
Yeah, no, I totally agree there. I've just put some slides up here now, which I'm going to show some slides around what type of things you need to look for repaired, but these are slides that actually show what we do, some of the processes we do when we repair, which actually answer the same question really. So, things like resetting of realigning jaws. You'll notice we're using a sort of brass hammer there to ensure there's no damage to the surface of the device, but that's a really common thing, realigning and resetting the forceps to the correct set. So there's certain sets for basic R3 forceps, such as Spencer Wells, to ensure that they're that when the first rack is engaged, that they're touching on the tip. And then there's a far more complex setup when you look at things like your DeBakey clamps and your Coole clamps. So there's a real need when you're in-house and you're checking your forceps, and if you don't know what the sets are, and if you're checking them in sterile processing, then I think it's worth asking an instrument manufacturer to give you some indication on that. Of course, sharpening, induction brazing for needle holder tips, polishing, cleaning, passivating, laser welding, all really common processes we do nowadays. And just to put up some of Rick's cards, and I'm not really doing them justice here on my scanned slides, so some tips that Rick Schultz would give through his cards, and obviously inspecting blades, making sure that they're round on things like Mayo scissors, checking for pits, checking for dents on screws, making sure there's no cracks, and obviously checking for things like blood, smooth action, ensuring they're smooth. And I think test material wise, Bob and I were having a chat before we came on the call, and I was saying that I've heard a few times in the UK that sterile processing departments or sterile service departments won't check the scissors because it's viewed that it's a sort of objective thing and that the surgeon will determine that. Do you see these test materials being used in the States, Bob? Because this is, I guess, born from the German standard, these different test materials.
Yeah, it's very, very intermittent. It's something that absolutely should be happening every time. And I've heard that same reasoning here in the United States, where people say, well, why should we test it? Because the surgeon's going to do that. And I think it's really important to look down at the bottom of this slide where you see that testing material that they're cutting through. If we don't test to make sure the instruments are sharp and sterile processing in the CSSD, then the test subject is the patient. And that's never a good place for the surgeon to be working in a very, very delicate part of the body and then find out that the scissors are not cutting and they're just kind of chewing the tissue. Then you've got a hurt patient, but also you've got a very frustrated surgeon who now is focused on his instruments not working or her instruments not working, where they should be focused on the patient. So it's really important that sterile processing CSSDs take over this quality management of the instrument sets. We want to send instruments to the operating theater that are fully functional every single time.
Yeah, no, I agree. I think there's a worry of liability. You know, once someone's signed off a scissor and says it's cutting because they've tested it on some material, but I think it's always with a disclaimer that, you know, you're assuming because something could happen to the scissor, you know, somehow once it's in the tray. So, you know, you can only do as much as your procedure that you lay out to test the scissor, and providing that's evidenced, then I think that, you know, that should be sufficient cover to not put people off doing it. So there's other areas as well that obviously when we're looking at things like this is what we call a Halstead, we would have an A in the description, so slightly different spelling. Obviously inspecting jaws for tissue, make sure the tips meet, make sure they don't overlap. Obviously, they have to be repaired. And obviously testing the ratchet, making sure that holds on. There's like a drop test. If you click it together and drop it, it shouldn't jump off the rack, or it should really go for repair because it could come undone while it's in use. Similarly with like tissue forceps, so again, making sure the teeth mesh, and the device is smoothly operating. Add and dressing forceps. Again, it's really all about just making sure the condition of the instrument is acceptable. Make sure there's no cracks, there's no rust. Making sure that, I think quite often on things like the dressing forceps at the back where they're riveted, over time you might get cracks, so it's looking out for that as well. And then on to your bigger retractors, again making sure that the prongs interlink correctly. If they're sharp, make sure they're sharp, or if they're blunt, make sure they've not got any jagged edges or any pits or marks out of them. Inspecting the hinges and working the levers and establishing a real solid procedure to make sure that's all happening. So this is the sort of thing we don't want to see on a scissor. This is an attempt at somebody repairing a supercut scissor, really expensive Stille supercut scissor, which we, obviously, I think if we're repairing something, it should be to put it back to optimum clinical performance. And obviously this won't do the job, could potentially hurt somebody as well. So if you're having repairs done, making sure that they're checked when they come back to you. A visual, really, as a quick visual and feeling the instruments before they're put back on the tray is important. That's what they should look like, as I mentioned earlier. And repairing is also about, I think, returning that sort of feel-good factor to the devices. I mean, this is a refurbished mallet, but people think that devices are new. Surgeons like that. You can also at the same time remove all the scratches and any recesses where you might get protein or anything like that sitting potentially, or any contaminants, and also reducing the risk of sterile surgical site infection. So this is some keratosis rongers, which infamously tend to be or can be difficult to clean. So obviously having a repair or maintenance program is important, because it means that your repair supplier can open the devices up, take them apart, and potentially clean, and making sure they're clean and free from debris for you.
Dan, this is a great one where if a facility has the capability, I always recommend that they go to the take apart keratins so they can be cleaned each and every time. If the sets aren't inspected or sent out for repair, but maybe once a week or even once a month, the potential for that bioburden being harbored in the keratins that are non-take apart is much greater. So I do see a lot of folks moving toward those take apart kerosins.
Yeah, I mean, it seems a common sense thing. It's obviously a lot of time it's, winning sort of hearts and minds and getting the surgeon to change over because they probably do feel a bit different, but it's got to be so much easier for everybody really, and to reduce the risk. I thought you might like this shot, Bob, of like the three amigos here with their tape on them. This is a particular surgeon's set, and they've had to identify it. So they've got tape. I mean, for starters, the gold plating has really deteriorated on these on the eyelid retractors here, and yeah, certainly. I mean, this was on one tray, so you've got one nice, still sort of semi-bright gold eyelid retractor, and another that's really, really tarnished and shouldn't be going near anyone's eye. So yeah, vigilance, and it's common sense. I think looking at these instruments, it should be an alarm bell straight away that they shouldn't be in that sort of condition.
Dan, I think it's important to point out too, if you look at the caliper that's in the middle,
yeah,
on the right arm, you can see where the instrument was once taped and how it has corrosion, and kind of the perfect little marks there. So just an illustration of what happens underneath the tape when an instrument is taped or dipped or something.
Yeah. You get this type of corrosion on different joints. It can be box joints. This is a very zoomed in image here. But what happens is, and it's again something to look out for, I think sometimes this will naturally happen in scissors. This isn't something you will ever avoid, but it's just something to be aware of, that once a scissor starts to bed in, and if you're working a scissor, it can cause these sort of score marks. Just using lubricant can avoid it. What we don't want is the surface gets really damaged and it starts to corrode or rust. But I mean, rarely are you going to pick up a scissor that's been on a tray for a while and not see some sort of score marking on it. Would you agree on that one, Bob?
100%. And we always want to catch them and lube them, like you said, before we start seeing that pitting corrosion in the instrument, because then it's basically we have to throw it away.
Yeah, then it's too late. I mean, you've got a SEMS forceps here that you'll see right on the end there. There's some pitting, something to look out for sure, and it's probably where, if we look, I think I've got a alternate picture here. Yeah, if you look on the other arm, you can see where you've got like liquid that's been recessed in there. So obviously, perhaps it's been shut up after it's been used, and over time, if that's a habit that's taken place, a little pit started to form there on the inside of the device, and that will obviously only get worse. So not only are you worried about the device snapping, but of course you're also how can you assure that you're sterilizing in that hole, which I'm not a sterilization expert, but I'd question if that's actually achievable.
Very much.
That's where we need Hank on, I think, to give us that bit of input there. So stress corrosion on box joints, again, you need to use lubricant, or you can get this scenario where you get obviously a crack appearing on the device coming away from the rivet. And yeah, if we use lubricant, it will reduce the risk of that. This is common. This is quite common on instruments. Again, you've got a mechanical working part, and generally speaking, this is something after the device has been in use for quite a while, but very common. Also, you'll see the discoloration at the back of the box joint as well, and that's could well be from an issue with water that has damaged the surface of the steel. It could be a chemistry thing, or sometimes even some different colorings are as a result of silicates. Obviously, that's something that's broken. That's fairly obvious. But again, on a box joint, when things are overstrained, nothing's made out of any. As we've shown, we've got raw materials here from the earth, iron. If anything's overstrained, it's only hardened up to a certain level, it will get a crack, and that crack might not happen. It might not break straight away, but it might be a gradual thing. And that's why I think it's so important, as Bob mentioned, to get a microscope and have a look, so you pick up that, because it might be it's been overstrained, that we've seen delicate artery forceps be used on areas of tissue that are very, very bigger, bulkier areas of tissue, and they put the device under strain, and you get these micro cracks, which will gradually expand. What we tend to do when we're testing the instruments in-house before they're shipped out is you put them under a stress test, so you force this cracking to happen on devices if they're faulty before they go out into field. So that's how we try to avoid that. So maybe even implementing something like that in your department could be a good measure. And pitting, that pitting is something that you see from time to time on instruments that is generally a result of some sort of chlorides in the water, in the wash water. Once the pit forms in the instrument, the chloride will attack and react with that pit, and then you'll just get this like attrition on the surface of the instrument that causes this damage.
It's very important that these instruments are found and removed from the sets because, like you said, they absolutely cannot be cleaned. I often refer to it kind of as the iceberg. We see that small portion that sticks out of the water, but we don't see the larger piece that's underneath. And same with that stainless steel. We don't know how deep and how far the damage is in those pits. And so it literally makes them impossible to clean.
Yeah, definitely. And I think it's a similar thing. This is the needle holder image I mentioned. Like, you can really see how I couldn't even see, and I saw this device from the naked eye. You can't tell that tungsten carbide is chipped, but it's chipped, and there's also the side of the needle holder is damaged, and that started leaching out iron after it started to corrode. So not only is the tip damaged, and that could obviously, it's probably not going to perform particularly well when you're holding the needle, but you've also got the added issue there of rust forming, of course, as well. So yeah, not ideal. Being able to spot variations in materials. So this is a retractor that we saw on a set. Here we're talking about composition of stainless steel. You can see straight away that the obviously the nut that's used there to hold it together is made from a different steel, because that's gone a slight black color. So we would suspect that that's probably mild steel, and as somehow a mild steel piece has got into the manufacture process, or when it's been repaired, that's been put in. But that's what will happen if you don't have steel that has the right chemistry to maintain passivation, the correct composition to maintain passivation. And of course, scissors as well, very visual. Here we have some scissors that we'd found on the set. Obviously, you've got a very, very rough sharpening job there on the repair side of things. Not only have you got really rough score marks, but you've got dirt there as well. The scissors won't work. These were sort of beyond repair, but they've just been cut back and back and back, and obviously they'll be beyond repair eventually. But you've got to know what you're doing when you're repairing scissors. So and not just know how to sharpen it, but know also how the scissors actually going to be used and in what circumstances, because this sort of thing, Bob, you're potentially harboring bioburden, because how are you possibly going to ensure that's clean along that edge?
Yeah, absolutely. And when it looks like this, it's very hard to tell the difference between corrosion and bioburden. So again, it kind of points us back to that lighted magnification, so we can really see what's going on with the instrument.
Yeah, indeed. Yeah, retractors, check on the racks. You'll see a bit of deterioration there around a weld. That quite often happens on the older ones, which may just be, sorry, not welded. They're either, there's actually either no, there's either a gap there from sort of older style ones, or there'll be solder. So that's important to check on those. And then you've got nice visuals here, grips here, which may be where the surgeon's been holding the scissor, the pot scissor here, and obviously potentially saline. We think these are probably used in the cardiovascular setting, so could be saline on the grips, and obviously where they've been holding them in the same place over a number of hours. But yeah, it's just vigilance and spotting these different surface changes before they become a real problem. And this is these are produced by one of the top manufacturers in the world. There's no issue with the steel or anything here. They're top quality devices, but anything can happen when you've got these mix of chemistries involved. I just wanted to show this image. We're coming to the last couple now, so apologies, we're overrunning slightly. A take apart kerosene ronger, and this is just something I wanted to flag, making sure you understand the instructions for use, and if there isn't an instruction for use with a device such as this kerosene, which may seem obvious to me that you flick the trigger at the back and take it apart, you really have to rehearse these things so you know how to assemble and unassemble. It's like assembling the rifle and then being able to take it apart and put it back together again. And you should get the sales guys who you're working with to come in and help you run through that, because there are some slight nuances between the different devices, and if it's not explained in the IFU, or if you've just got a reprocessing instruction, it's hard to spot these. So I mean, kerosenes alone, I must have seen 10 different varieties of how to take them apart. And I think, Bob, even as someone, with your experience, it's a challenge to be able to work something out immediately, isn't it? Particularly if you're under pressure to process a tray.
Very much so.
Yeah. So so my advice would be, if you're not sure, speak to the sales rep or somebody who may have that knowledge.
Absolutely.
Protected instruments, obviously vitally important. We have a picture of some silicone cuttings here with a fine hand set in, which some of the devices are slightly more robust, but obviously I think, and a colleague of mine, Pavel, is very passionate about shadowing on instruments and making sure trays are laid out correctly. But obviously it goes without saying that if the devices are on top of each other and it's a messy tray and everything's not laid out neatly so that the instruments can be washed efficiently, so that's really important, and things are improving in these areas all the time. I'd personally like to see more from the washer disinfector companies and the to actually work with the instrument manufacturers to try and come up with better solutions, because I think I've said before, like you have on a household dishwasher, you're only washing knives and forks and some plates, but you've got a range of different solutions in there just for those basic devices to ensure they're clean. So surely we can collaborate and come up with something that will be suitable for even 4,000 instruments.
Absolutely.
So of course there's containers as well. We want to make sure that when you're using containers that that the seals are all intact. That's very, very important. Make sure also that even if you've got a tin which the seals are intact on, that you don't have any big dents in them, because it can distort the seal when the instrument when the container's clamped down itself. And obviously getting some sort of testing on these to try and do some sort of in situ validation, which is not easy, but is an important factor, because again, it's a mechanical device, and having them regularly checked, or developing an SOP so you check them regularly yourself. Again, it's time though, Bob, isn't it? It's trying to establish these good practices and making time for it.
100%. That's one of the biggest challenges. Often these departments are inadequately staffed, and they just can't perform the inspection piece the way that they should, because they're just trying to get product back to the customer. And it really makes a big difference when you're given the opportunity to properly inspect all of these devices.
Yeah, totally. Okay, so finally, just to sum up some tools to consider. Inspection kit, which I think is quite interesting, that's available through Germany, which is based on the DIN standards. So you've got your red and yellow test materials there, and some other testing matter, things that are useful for things like osteotomes, chisels. So that's something to consider. Rick Schultz's book, as I mentioned, and his cards, which although there are some slight differences between the UK and the US in terms of what the names of the instruments, this is the best illustration and but certainly the best publication I've ever seen for our industry. And catalogues, not just our new version 4 catalogue, but any instrument catalogue is always a good resource for learning. I think having instrument catalogues on the shelf as we move to an age of electronic catalogues, I like to think the hard copy catalogue will be around for a long time for surgical instruments. and obviously different sections, of course, that you'll see through those catalogues. The a free download is on the ABHI website, which is Association of British Healthcare Industries, for our surgical instrument inspection and care guide, and the German Red Book, which gives great insight into, if you're starting off in the industry, as to what to look out for in the variety of different scenarios and situations for instruments. I'd highly recommend that, and happy to share that. Please message me if you need the link. Thank you for listening, and just going to attempt to pop the camera back up so we can have any other questions, or we've got a few questions, Bob, coming. So let's have a look. So interestingly, Gordon has posted to say, unfortunately, I think until it's written in the guidance, the HTMs, sterile services in the UK won't test instruments beyond visual inspection and basic functionality tests. And Gordon said, Bob, are you aware of any specific testing guidance in the US?
Yes, our AMI document from the Association of the Manufacturer of Instruments speaks specifically to that visual inspection, and it's in our document requiring that to happen. So yeah, we have that here, and it really should be something, if it's not in your document, that should be there, because it's a vital piece of the quality and the life cycle of your instrumentation.
Great. So there you go. I'm sure Gordon, Bob would be happy to share a link or where you can actually get this document from. So another question here from Andrew, or it may be a question or point. There is needle size recommendation for different needle holder. Is the same size applicable to the stainless steel version? I'd have to check into that, to be honest. So I think what Andrew's saying is, obviously, I've showed that graphic of different size jaws. When you see just stainless steel jaws, is it the same principle for the different sizes of needles?
Yes.
Yeah, it is. Yeah. Okay.
Yeah.
Excellent. Thank you. And concern of mixing floor grade instruments in a set causing the spread of corrosion to the rest of the instruments. Does the concern apply if we are mixing different brands of instruments in a set, even though the instruments are still premium? Any effect to the set if we mix the instrument made by different stainless steel compositions and different brands? I mean, I would say, providing that the materials are all of the correct international standard to the correct compositions, then there shouldn't really be an issue, should there, Bob?
No issue there. One thing I do talk to folks about is that when you do that, you have something called pattern variations. So you may have 12 hemostats in the set, and all of them have a different angle or a different width on the tip. And it's not always a huge deal, but then when you have a surgeon who might be wearing loops, like a vascular surgeon or a neurosurgeon, those millimeters of difference can really make a big challenge for that surgeon. So I always recommend that folks, as best as they can, have the same vendor in their trays. And I know this is a challenge because through the years, our purchasing departments will purchase from one company because they're much cheaper, or whatever the fact may be, but you'll see lots of different vendors in trays. So if you can standardize, it's much better. But the steels, like you said, should not be a big reaction with one another if they're from a quality manufacturing process.
Yeah, but I see what you're saying, because a tray I saw recently had instruments literally from 45 years ago all the way through to like had just been purchased. And although it's, you know, as a stainless steel, it should be the same. Different ages of stainless steel, different origins. Certainly, again, if you then look at change in regulation as well, that's also something which is a challenge, because you're going from before CE marking, so before sort of 96 or 95, whenever it was, and to instruments that are then CE marked and then potentially come under more scrutiny. So yeah, it's I think consistency ideally would be good. I don't know if there's any other, just wait to see if there's any other questions come up. I could, if I had the ability to do so, open the audio up as well. Give me a moment. Attendees. Okay, I'll just try and click on this to see if anybody has a question they want to shout out. Okay, so if we have any other questions now, hopefully everybody can hear us. Please, please fire away. All right. That either hasn't worked or there's no more questions. So. Okay. Sorry, Bob, muted you.
Oh, that's okay. I was just joking and saying no questions means we explained everything perfectly.
Yeah, well, I think it might be more to do with my lack of ability to work the computer, but yeah, let's just see if there's any others that have come in, and then we'll sign off. Okay, one more. In our hospital, we're using gauze to test our scissors. Is this sufficient, or must we get a testing kit? I mean, I think it should be a testing material from a standard, really, shouldn't it, Bob?
Absolutely. And actually, some folks, even from the German side, from my days with Askilab, when they trained me, they will use a fine mesh gauze to test micro scissors. Right. But the best material would be that non-latex rubber material that they can use, the red for your heavier scissors, your Mayos, your Metzenbaums, and then the yellow for your finer scissors, your Iris and tenotomy scissors. So okay. Yeah, I would highly recommend getting a test kit.
Okay. Yeah, I mean, from obviously over the years, the British standard we've tend to follow, which has things like, you know, tissue paper and certain types of gauze, which you know, Andrew, I'm sure that would be fine. I think as long as you have a procedure where you have it written down and justified and sort of validated against the standard, I'm sure that would be absolutely fine. But of course, you've got to make sure that it's applicable to that correct device, haven't you? So excellent. Okay, well, I think that's all. Bob, thank you very much for your excellent assistance along the way. Again, really enjoyed this session, and we're gonna share it online. I think hopefully we're gonna get it posted through the Beyond Clean YouTube as well, which would be lovely. So
wonderful.
Okay.
Well, thank you so much for having me. It's been an honor.
No, our pleasure, and thank you for your help. Okay, you take care. Thank you, everybody. We're signing off now. Thank you. Bye-bye.
Bye-bye.
Bye.